Okay. All right. Okay. Okay, that's great. All right. Good morning. Good morning again. Thank you for joining the class. This is today's is gonna be the last class, the fourth hour. Okay, and we're going to go through some really interesting things. It's just 1 hour, but I'm going to try to be as usual, very brief, very concrete, so as to make the most of the hour. The important here, and we will make some summary at the end of the day, at the end of the hour. However, it's very important for me to transmit you, to tell you about what is the healthcare sector undergoing in the last 10, 15 years, and all the new technology and all the new environment that we really need to make sure that we are aware of it and make the changes, the internal changes, so as to accomplish the new objectives. Today we have like three topics. We're gonna start with service quality, okay, and value creation in healthcare, okay. Because I mean, healthcare it's changed from just clinical effectiveness and safety. Today's service-oriented complex system demand a better perspective, okay, that view the quality as a driver of value. Okay, that's important, you know. Of course, you need to have it will arise institutional differentiation and the loyalty of the patient will be much better on the long time. Okay. Um, the service quality, uh, it could be subjective, it could be objective. Okay, that's a little bit of a definition in the quality, and we have here some issues to touch, like technical quality, diagnostic accuracy, uh, all this stuff. Functional quality, it's another pillar of the quality. You know, communication, empathy, waiting time. Everything regarding the. We check it also we show it on the journey, and of course the structural. You know, the environmental quality. I'm talking ambient, safety, cleanliness. Okay, so unlike goods, I mean, health service are not tangible. They are heterogeneous and always and normally co-produced by the provider and the patient. Okay, so the quality. it makes very experience dependent, if you can say so. Okay, let me introduce you. I hope that you check this in the technical document. Let me introduce you the Donavedian's framework. Um, it's a model for assessing the healthcare quality, developed by Mr. Avedis Donavedian, and it is based on three interconnected components. Okay, we need to check. Let me put this. Okay, we need to check these three components, which are totally interconnected. Okay, we have structure. Okay, I mean here the content of care, facilities, staff. Okay, it has the physical and organizational resources. Second component is the process. Okay, it describes the interaction between patients and providers. Activities in delivering the healthcare. And the third one is the outcome. Okay, it's the effect of care on a patient's health status. Okay, I mean by the results. This is the so okay here. Like examples, okay, on the structure, three. These are the three. So the structure here, process and outcomes. Okay, you have resource, infrastructure, you have facility, staff, ratio, equipment. On the process, which activities again and interaction, you have protocols, communication, these clinical protocols. On the outcomes, the results, that's the effect. You have, for example, recovery rate, readmissions. Okay, so this is you can be this is our quantitative items, that you can measure. Okay, and yeah, I mean each layer helps to a better, to the perception of the value. Okay, but here it is important. The process and outcome quality are increasingly in the model evaluation. No question about that. Uh, that's the Donavedian. Okay, by these three structure, by these three components that don't forget that they are totally interconnected. We can make an assessment. Okay, and find out what is the quality perceived, the quality that we are offering. Sometimes quality, it's something, the best definition for me that I heard in my life about quality is it's it's the one which is perceived by the patient. Okay, do you if you invest a lot but you are not able to transmit and for the patients to receive this quality, you have failed. So quality is something that has to be 100% perceived by the patient in this case. Uh, some tools to measure this service quality. There is a wide range of quantitative and qualitative instruments, making this assessment, okay, and combines patient feedback and also with really strict and operational performance metrics. We have here, I selected some of them for you. Hospital Consumer Assessment of Healthcare Provider and System, that's a huge acronym, HCA-HPS. You have here also the Peak Experience Survey, NPS, Net Promoter Score. I think that you know all of them, of the definition are also in the technical document, the prompts, the prems, and the mystery audits. Okay, that's very interesting. This is very used, and you can measure really and to have, on a first person opinion. This is the quality perceived by these mystery patient audits. It's like a fake guy who is going to the installation and he seems to be a patient or seems to be one of the guys of the ecosystem of the healthcare, and then he makes the assessment, in a real world experience. This is very used and everyday uh, more and more. Some others, uh, performance metric, there are plenty of them. I selected some for you. So, time to treatment, infection rates, staff turnover. That's important. Complaint frequency, readmission rates, patient satisfaction score, and so on. So here you can have this. Sorry, have this. The quality. Quality. It's again. It's very important, but you need to measure it. Okay. No matter if you invest. Sorry, somebody should mute. Guys, Shao, could you please mute? Shao. Well, all right. Somebody's Mrs. or Miss Shao Yuhan, please could you mute your microphone, please again. Shao, please mute. Let me Shao. One moment, because if not, please mute the microphone. Microphone. Thank you. All right. So, well, that's things happens. No problem about that. All right. I hope that she or he listened to me. All right. So let's move it to Michael Porter's value-based healthcare. That's very interesting. Huh? Uh, Here there is it restructures healthcare. To maximize this value. Here we are talking about value for patients. And this is defined like patient health outcomes achieved per dollar spent. Okay, this is a real metric. Okay, um, Porter's concept shift the focus for the volume of service provided. The traditional fee for service model to the results and outcomes that matter most to patients. So central point here, guys. By improving value, healthcare providers can enhance quality, can reduce cost, and improve the sustainability of healthcare system. Okay, this is a nice words, but again, I mean, let me refresh it. Uh, Enhance quality, reduce cost, improve sustainability of care system. That's tremendous. Okay, so what are the six components uh, framework that Porter, Porter is one of the gurus of the marketing, So first one, it's organized into integrated practice units, EPUs. But by this, Porter means that instead of organizing care around medical specialties, care should be structured around the patient's medical conditions for the full cycle of use. This sure brings together all the necessary clinicals and supporting staff to treat the condition in a single, in a dedicated unit. Okay. Second point, it's the measure outcomes and cost for every patient. So by that, Porter means this involves systematically and constantly measuring the results of care, that matter to the patient. Okay, of course, as well as the cost involved in delivering these outcomes. This sure goes beyond simple process measures to capture the full picture, of success, including, no question, recovery, functionality, long-term health, which is what we are looking for. Third point, it's that's interesting. We're talking here about money. Move to bundled payments for care cycles. The idea here is that the payment system should transition from a fee-for-service model to a bundled payment model, which covers the total cost of care for the total full cycle of care. Okay, sure. This is good to collaborate all the managed costs to manage all the costs efficiently and achieve the best possible outcomes. Number four, It's here. Integrate care delivery across multiple sites. Okay. Uh, the idea here is that care for patient conditions should be coordinated across various facilities such as clinic, hospital, rehabilitation center, to make sure and to ensure a seamless and efficient experience. Okay, everything in a total. Okay. Number five, it's integrate, expand excellent service across geography. Here, the idea is that for patients in remote areas and those that needs especially care, value is increased, enhance it, and extending the UPS reach. Through virtual consultations or establishing, physically satellite location. And these four paradigms, okay, it builds an enable information technology, an IT platform. It's a big IT system that need to support the IPUs, measure the outcomes, measure the cost, and facilitates the integral care. Okay. No question, this platform should be patient centric, and it has to provide easy access, to the relevant patient data. No, do not do this dark. Make it as easy as possible. So that's the value-based healthcare. The key takeaways of purchase, that's what's important here. It focuses on patient outcomes, which is something maybe 20 years ago it was something totally different. Okay, so this is why it is a revolution. Costs are integral to value. Okay, it improves the outcomes, not cost cutting. That harms quality. Okay, it is a totally restructuring system. Okay, huge transformation. In the center is the value. Okay, and the last key takeaway is the measurement and transparency. Okay, that of course enables better improvement. Okay, that's all about Porter. So future directions, okay, where are we going? Where is this train going? Emerging trends, predictive quality modeling. We talked about that before. The use of the AI the artificial intelligence to anticipate, for example, complication or patient dissatisfaction before even that they occur. The dashboard, real-time dashboard, that's also interesting because it makes clinical and experiential data from immediate insights. Value-based procurement, uh, providers buying only proven effective devices and drugs. Okay, that's a value-based. And cross-order feedback. This is another trend, another future directions. Okay, you know. Here, this is I highlight that. I mean, institution that integrate that combine this data science with the empathy. That's which is very important, and sometimes we don't talk too much about that, about empathy. In my opinion, in the opinion of the not my opinion, the opinion of the leaders here, they will lead the next wave of quality-driven value creation. Okay, so if you are able to integrate all this science, all these new trends, and don't forget about the empathy, you will be leading, no question about that. So as a conclusion, guys, um, service quality, this is now imperative. Okay, it's at the heart, it's at the core of you want to have any competitive advantages, you need to take care of that. If you want to have better public trust, you need to take care of that. And of course, you want to have a better, more sustainable delivery in healthcare, you need to be aware of that. And here, don't forget about the people, okay? The leaders, okay? They blend, they have to measure, to inclusive design and to be really rational sensitive to build this system, and here that's the key. Where patients where patients, uh, okay, here, where patients are not only treated but truly cared for. Okay, that's important. Okay, so let's move to the next chapter, chapter number 11. Okay, we're gonna. That's a nice one. We're going to talk about how the patients behaves. Um, yes, and the users, they are not passive anymore. Okay, they are active decision makers. They are empowered by a lot of information. They are empowered by digital tools, and they are also empowered by consumer logic. Okay, so what is this about? Understanding how people make health decisions is now critical, as the service themselves. Health consumers' behavior could be cognitive, could be emotional, could be social, uh, cultural. Okay, and this influence, it's got a lot of influence on how people, how potential patients, how individuals select, engage, uh, and evaluate all the healthcare systems. We're gonna go through two or three okay models. We have here the rational, the health belief model. It's the health belief model. It's BL, HBM. It's inside the rational decision making model. Okay. Okay. This could be a little bit tricky, but it is not. Let me summarize it for you. It's the health belief model is just a conceptual framework that explains, it's which is important here, predict, okay, health related behaviors, by how, by focusing on individual beliefs, okay, and perception. Okay, it was developed in the 50s. It's still very valid. uh the model was at the beginning created to understand why people fail to participate in prevention and screening programs like tuberculosis, like other things. Okay. What is the proposal? The main proposal here, the HBM proposes that a person decision to act, it's influenced by their assessment on both the threat posed by a health issue and the value of taking action. Okay, so no question, this is the model more used in health promotion and disease prevention, and it has been applied to a broad range of behaviors, including immunization, chronic disease management, safety practices. Okay, you will see all this, how this is interconnected. Now, in the next slide, you will check it. Okay, you have here modifying variables that are affecting the perceived treat, the self-efficacy, okay, the perceived seriousness and substability, and then this is the likelihood of engaging in the promotion behavior. Let me. It is. I also select a video for you because it's gonna be interesting, and I really will love that you get this concept. Okay, so the six components, okay, of the health belief model. We have the perceived susceptibility, an individual's subjective assessment of the risk of acquiring disease in health condition. Okay, so summarizing, if a person believes that they are highly susceptible, they are more likely to take prevention action. This is one. Second one is perceived severity. Okay, for example, a person might perceive flu, influenza, not very serious under the medical point of view, but very serious under the financially point of view because it means missing days of work. Okay, so here we're talking about an individual's belief about the seriousness of a health condition, and the potential consequences. On the perceived benefits, that's the third component. That's the individual's belief in the effectiveness of taking specific actions to reduce the risk of seriousness of a condition. The action is more likely to be taken if the perceived benefits are high. Okay. The barriers that sometimes is more tricky, it's again individuals believe about the obstacles of performing recommended action. The barriers can include inconvenience, cost, discomfort, embarrassment sometimes. Okay. Uh, for a behavior to happen, for a behavior to occur, the perceived benefits must outweigh the perceived barriers. Okay. But number five, it's cues to actions, factors like internal and external that prompt an individual to take the action. Uh, Internal cues might be physical systems, for example, like an external cues can include health campaigns, reminders postcard from a doctor, the illness of a friend. Sometimes, okay, it sometimes makes us to take an action, and the self efficacy. Okay, that's the our capacity, to perform a specific behavior. Let me put you a nice video here, 2 minutes video. I mean, this is such a that's such a important that I selected the video for you 2 minutes to make sure everything is 100% understood. Okay, only 1 minute video. Sorry, sorry about that. All right. So I hope I hope that you uh, like that. Okay. Uh, Strengths, limitations. Of course, there is always a nice tool. There is some strengths and limitations. The strengths, uh, for sure, it's the easy of application. Okay. You see, it's individual focus. Okay, that's another strength. Okay, and empirical support. There is decades, like a lot of years of research that validated this model. Limitations, of course, overly cognitive. It doesn't account, and it is true, for emotional responses, social influences or habitual behavior. We will talk about that before. It doesn't take into account the context, just a little bit. It neglects broader social, economic, and environmental factors. And the predictive power is not too high, but at the end of the day, this is the most behavioral model used, you know. So let's move to another one. We're talking now about a rationality model. Okay, uh, that's true. I mean, I say here recent theories, but it is true that sometimes decision making is often biased, is often emotional, is often irrational. Okay, and this sometimes justify the nothing. You know, key concepts here. Important concept to take into account the loss aversions. Okay, people, it's interesting. Like by KK, people feel losses more than they value gains. Okay, so they prefer not to lose that gain. The framing effects, that's important, and that's some also some psychological things issue. How the choices are presenting. That's a nice example. You have a 95% of survival or 5% mortality, so it depends on who you tell that they position in one way or another. The bias, okay, it's the person, it's important, and the default effect, people sure stick with the preset option, on the psychological and emotional influences, this is another important thing to when talking about the patient's behavior, emotions such fear, hope, shame, anxiety, it really shaped the behavior, especially involving uncertainty, identity, or mortality. Okay. There is a theory, it is planned here, the theory of planned behavior, adds the role of social norms and perceived control in predicting intention and action. Uh, this is influenced by three components, which is first one, the attitude towards the behavior, the subjective norms, and the perceived behavioral control. Okay, the components to be a little bit more deeper. So it's the attitude towards the behavior. This is the individual's positive or negative evaluation of performing the behavior. It's just shaped by their beliefs about the likely consequences of the behavior. The subjective norms. This refers to the perceived social pressure to perform or not perform the behavior. It is based on the individual's belief about what is important. People in their life tells family, friends, what things that they should do. The perceived behavioral control. This is the individual's belief about how easy or difficult it's gonna be to perform this behavior. Okay, it reflects the confidence, the possibility to perform this behavior, and this is influenced by their beliefs about the presence of factors that may or may not facilitate this behavior. Okay, uh, how these how these three one two three how these three let me check how these three components works together. Uh, it combines then the behavioral uh, invention intention. Okay, that's the point. Okay, so a more positive attitude and a stronger belief that others expect the behavior, along with a higher sense of perceived behavioral control, lead to a better, a stronger intention to perform the behavior. Example, okay, clear example. Someone is more likely to exercise, to go to the gym, to make sport, if they believe the exercise is beneficial. This is the positive attitude. Their friends and family encourage it. That's the subjective norm. And they believe that they can fit into their schedule. Okay, perceive behavioral control. So we have in this, if you analyze the brain of the people on going to the gym or doing some sport. This is that three, the positive attitude, the subjective norm also, and the perceived behavior. Okay. Let's move to the next one, information search. Of course, this is something that we need to talk. I mean, before choosing uh, a treatment, a doctor, a treatment, consumer engage in a lot of information, and this has an influence also. Okay, the factors that influence that, health literacy. Okay, now there is a huge ability to obtain, to understand, and to use health information. Be careful with that. You know that not all the information is valid. Okay, that's maybe a little bit tricky. We will talk about that later. The health literacy. Okay, people now are able, they have the capacity to navigate these digital health platforms. The source credibility. Okay, is preference for physician advice, expertise, expert websites. Again, beware of the expert websites. Not not all not all the which are called by themselves expert art, and you know that. And the cognitive overload, that's sometimes is it's a barrier because too much data it can stop the decision. So patients with very low literacy levels experience uh, worse health outcomes. Okay, they experience higher cost and lower engagement. So on the other side, patients with high literacy levels, they experience better health outcomes, lower cost, and more engagement. Okay, so what is the point of that? I'm talking about that the marketing materials must use plain language, visual support, inclusive design. So this is all about marketing. So everything that the patient reads on the net and all these channels, it affects their decision. So let's work that with the marketing. Um, another important on the behavior here. I'm talking about here the segmentation of health consumers. Uh, no question, not all patients behave the same, uh, and we need to make a nice segmentation. Okay, to to provide some tools to the marketing. Here, for example, there is a segmentation of five. Have the pioneers, the proactive managers. Okay, what are the attributes? They are high health literacy. They seek second opinions. So, what is the marketing implication and goal? They need to provide comparative data. They need to provide transparency. So that's great, guys. I mean, this is what the marketing should focus on each segment of the patient. Second, we call it the delegators. The attributes of these guys, they trust the physician 100%. So what is the marketing here has to do? Reinforce professional authority and credentials. Uh, that's a lot of websites that are doing that. A lot of personal brand of the physicians. We have another one, which are the skeptics. Okay, skeptics. They have a very low trust. They always are trying to seek alternatives. So what is the marketing has to do here? What is the marketing? Need to build credibility. Uh, that's the main goal. Of course, we have another segmentation in terms of money, which are the price sensitive. Okay. Uh, they are moving by the affordability, by the body. They are moving if they can afford the treatment or not. Uh, what can marketing do here? They need to offer cost breakdown, flexibility on the payments, some payments tools. Um, and then we have the avoiders. Okay, the guys that are always fear. They delay the care. They fears everything. Okay, you see, they just think on the health institution, and they step back. Well, it's easy for marketing here. The goal: use reassuring messaging and reduce barriers. This is maybe one of the slides more important in terms of marketing. Okay, because segmentation in marketing is crucial. I mean, if you want to hit one target, you need to define what is the target first. Okay, segmentation is crucial. It is crucial for the consumer goods. It is still very crucial for the healthcare sector. Okay, so I really encourage you to keep this slide close to you. Okay. Uh, Cultural and social determinants. This is another important thing when we talk about um, behavior. Okay. This cultural framework shape how the health is discussed, how health is perceived. Um, Collectivist cultures, health decisions are family centered here, not individual. We're talking here Latin American societies, for example. Uh, Another cultural or social determinants in the alternative medicine, some beliefs that may compete with biomedical models. Gender roles, this is another social determinant here, okay? This can influence, for example, stigma for men seeking mental health support. This is the truth. There is a stigma now. And also the religious values, okay? It can affect the acceptance of the treatment, transfusions, reproductive techniques, okay? This is another cultural or religional determinant, So here I like to say, and this is something I want to highlight, uh, marketeers must avoid ethnocentric assumption and work on the integration, and use, this uh, messaging to do it inclusive. Okay. Uh, let's move to the digital health and e-patients. Okay. So what is e-patient? It's something created by the internet. The guy now, we call e-patient somebody who is equipped, engaged, empowered. Okay, the patient is equipped with information. They have access to a huge medical knowledge. They are engaged in decision. They are active participant in treatment planning. Okay, before it doesn't exist. He was just a, a an act that he just follow rules. It is empowered to challenge, question authority, seek alternative. Okay, so that's their passion, and it's enabled by the technology. They use apps for sure, forum, wearables, telemedicine, all about that. So this uh, digital autonomy changes provider patient power dynamics and demands more transparent dialogic marketing. Okay, digital tools. Well, you know that review sites, patient communities, patients like me, and so on, and wearables. This is something it's very important, and of course, on the self management, also the telemedicine platform. That's it's very 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 used now. Okay. I want to talk about before coming to the next point about the ethical consideration. Okay. Well, well, well. This behavioral model, you see, that we have rational behavior, irrational behavior, behavior influenced by the culture, inferior behavior influenced by the religion and so on. Some concerns, the ethical. Okay, nudging versus manipulation. Okay, so it's nudging empowerment or it's manipulation. You think about that. I hope this is empowerment. Okay, exploit vulnerability. Uh, in terms of marketing, do persuasive campaigns exploit fear or vulnerability? Discriminatory targeting is targeted advertising discriminatory if it profiles based on age, race, health conditions. Okay, think on that when making some campaigns. Okay, there is nothing worse than to launch a campaign and the result is you to be signed to be touched like a discriminatory guy. And the elective procedures. Can institution justify this marketing procedure with emotional appeals? Well, ethical considerations. Think a little bit on that. Marketeers here, health marketeers have to they need to balance this strategy with huge and no doubt respect for the autonomy, for the beneficence, and the justice, and it is important to follow these professional codes and ethic boards. Okay, so this is all about consumer behavior and decision making. We're going to spend the next 15 minutes in the future trends because it's also challenging, uh, and this is what is where we were, where are we now, and where are we gonna be. Um, uh, let me be very clear here. So healthcare sector is undergoing a systemic transformation. No, aging populations, chronic disease, rising cost, digital disruptions, empower consumers. Okay, this is converging into something that some people call a perfect storm of change. Okay, marketing, uh, before considered like auxiliary, like a secondary function in the healthcare, now is emerging. Okay, it's emerging to a strategical level, capable of shaping institutional identity, trust, innovation, and competitiveness. Okay, um, think on marketing. Okay, think on the scenario we are now. Think on these targeted guys, that we talked before, and think on marketing like a strategic tool. Okay, let's explore, these emerging trends, technologies, paradigms, that are defining the next decade of healthcare. We will talk about AI, personalization, value ecosystem. It will be quite fun. Yeah, marketing is now emerging at a strategic level. Summer change, that's what I told you before. Um, First, future trend, AI. AI, it's everywhere. It is transforming how the institution interact, how they segment, they communicate with the patients. Some key application include, there are lots of them. I selected for me the four more important. The predictive analytics, that's huge. You can anticipate when a patient is likely to churn, likely to miss appointments, even delay a preventive care. Okay, you can use that also, these predictive analytics, to trigger personalized reminders of rich campaigns. You have chatbots and virtual agents also, like another tool. Uh, you get with that 24/7 availability for the frequent question, for the triage, for the navigation. Okay, and this also reduce the staff burden. The non add value job. And improve the response a lot. Okay. Uh, Third one that I said for you guys is the content personalization. Artificial intelligence curates educational materials based on behavior, based on condition or demographic. And also this content empowers the patient with relevant, timely content. That's another thing also. You can create this automatically. And you have here the sentiment analysis. You can, and this is very trendy now. When you find all these opinions, there are tools on the artificial intelligence that can help you to can help you to to to, to understand, to give you a summary of what is the sentiment, the sentiment of your service, or your healthcare institution. uh, it's I've seen that live, and that's incredible. It's really analyzed the patient feedbacks across all the channels, social media, surveys, call, and the most important here, it detects satisfaction or detects dissatisfaction, and on this emotional opinion. That's very interesting, and most of the big companies are moving here on this. They are using the AI for that, in a very deep way. So here, a call, okay, ethical. uh, concerns, okay, around algorithms, bias, transparency, be aware of that, okay, because sometimes the AI is not always, yeah, it's not always ethical, okay. All right. Um, Another thing is, I mean, another trend, I mean, future of the healthcare is it's one to one, no question. Okay, this is coming from consumer sectors. Okay, now we are applying in the healthcare hyper personalization. Okay, dynamic content. Okay, websites, emails, adapted. You get the target, you get the message, uh, prior interaction and preferences. The message can be adaptive. Okay, communication failure of health literacy levels, preferences, and location. You have behavioral segmentation. You can work here on the preventing campaigns. Uh, However, which is the tricky thing here, the difficulty here is that this shift requires a very huge, robust data integration, cross-channel, consistency, and have a real clear value, communication, nice paths, to avoid the user, to over hyperventilate, to overwhelm. Okay. Uh, for example, okay, a diabetic patient receives targeted nutrition videos, local appointment suggestion, automated reminders. All is driven by integrated the CRM, the AI system, the AI. Okay, so sometimes this could be a little bit, overwhelmed. Uh, Omnichannel experience. That's this is again also again about marketing. I that's my humble suggestion. Healthcare marketeers must adopt an omnichannel mindset. We're talking about touch points on physical, on the digital, on the relational. But don't forget about the relational. And they has to be synchronized. Marketing has to touch all these scenarios, channels that I suggest for you, website, okay? When to use, these channels, website, service discovery, booking, education. This is already, this is already happening. Mobile app, I mean, appointment management, medication reminders. Okay, I think there is still a lot to grow on the medical apps. Okay, at least in Europe, the level of the medical apps, the services that you get with that are very low. Um, I still don't know why, but I think that there is a gap here between what we expect and what we have. So if any health institution really think on that and works and really measures or size or accurates the expectation of the user like me or like you, and they see the gap and they work on that, they can have a very competitive position. Okay, social media. Okay, yeah, I mean brand visibility, to use for brand visibility, health awareness campaign, so on. Email, SMS. SMS is a little bit old-fashioned now, at least in Europe. Okay, so use cases for engagement loops, follow-up, nudging. Okay, and the on-site experience. Design the service flow. So here, the key to success, and that's very important. Okay, the interoperability. Okay, patients should not feel different feelings. When moving from one platform or department, they really need to like need to have like to feel in in the same, surrounded by the same feelings, no matter if it's website, no matter if it's social media. Okay, so there has to be a consistency, in all these channels. Okay, this is something that marketing need to think at the beginning, and to make an omni-channel presence with the same characteristic. Okay, ethics. Yeah, that's another trend. Okay, trust. Now we are talking about trust. What is trust? Is the cornerstone, of marketing. We have here data privacy, uh, clear policies, and patient control over personal health information. That's clear. Uh, Algorithm transparency. This is something that nobody really knows. What is the transparency of the algorithms using AI? Okay. We will love to have an explainable AI and even to audit it, for all the automatic release. The truth is that it is not. We don't know. When we use the AI, but we don't really understand what is inside, what are the constraints of that. Inclusive design, okay, to avoid discriminatory targeting and make sure accessibility for everybody. And the value aligned messaging, communicating institutional mission alongside service benefits. Okay. So talking about here brands, okay, there is a differentiation on social, environmental, ethical issues, and be aware of the digitally native generation, okay, like people on the 20s, people on the 25s, and people on the fifth on the 20s, okay. If we move to globalization and localization. This is not bad spell. This is well, okay. So here we want to talk about that there is a health consumption on the cross border is rising because patients that can afford that seeks elective surgery, seeks everything. I mean, fertility treatment, wellness program, even abroad. So you need to have a global reach when dealing in the healthcare marketing. Okay, you need to be ready to have this multilingual website. You really need to be ready to have these telehealth services in all the idioms, international accreditation. If you are making some services in one country, maybe the accreditation is different than in the other, but always need to adapt. Okay, you can have facilities in 5 countries or 10 countries, but you need to have this local adaptation. You need to have this sensitive communication. You need to be aware of the marketing side. So what is local? It's global. Local is coming from global infrastructure with local execution. This is the greatest. It's gonna be, if you have a good system and you are able to adapt it to the local market, you will be really successfully. You will dominate. Health marketing international. And in especially here in these tourist hubs. That we have not talk a lot about that, but it is happening. Okay. Yeah. So global strategies again is coming from global infrastructure and local execution. This is the things to find. Um. Sorry. Okay. Uh. We move to the strategic brand. We talk about in the brand. Future to create meaning with patients. Uh, the branding moves beyond logos to lived experience. That's the message. Okay. The brands that are gonna be ready has to be the one creating this meaning with patient that really can also integrate this storytelling we told in the past and design this emotional value. Uh, don't forget about that. We saw it in the first day, the value ecosystem, and the cross-sector alliances. We said each of us in the first day. I like to say it also the last day. Okay, there is an ecosystem. The tech firms, Google, Health, Apple, digital therapeutics. Okay, with the retail pharmacies, with the wellness platform and the insurance. That's the integral health, journey. And here what it has to do with marketing, because marketing has to coordinate all this, all these ecosystems, actors of the ecosystem, um, future professional roles in healthcare marketing. Um, of course, uh, new trends, new technology creates new roles. There's gonna be there are still, the chief patient experience officer. The key skill will be journey mapping. I hope that you remember the journey mapping of last week, empathy design, metrics. The health data strategy is going to be another role. It's going to happen. It's going to be the skills is going to be to analyze data, to governance the EI. That's important. The dashboard. The DLE, the digital engagement lead. Okay, the skills required will be used kind of channel orchestration. Okay, this is all about marketing. That's going to be a very, very interesting role, there is still guys doing that, okay, but this is the name that will appear in the future. And the health communication ethics, okay, that's for me, it's one of the most important roles, okay. They will be watching the ethic, okay, and so on. So, guys, future is co-created, okay. Uh, the future of the healthcare marketing is not just campaigns, it's not just advertising. It's a system of create trust, of create empathy, create intelligence and values. Okay. Um, so here, strategic transformation, commitment, partners, co-creating future of health for sure. And I like to finish this doctoral course with this sentence. Okay, future co-created, and we and you are the one uh, managing this. Okay, so I really hope that these 4 hours and all the literary that I give you is gonna hit your target. I hope that you get the most of this course. I'm sure that you did. For me, it's a pleasure to be with you this time. You know that I can be easily reached by the in the campus. If you have any question, if you want any additional any additional uh, any additional information for any of the topics, I am always happy to to help you. And that's all. I hope that we meet in the future soon. And thank you for your kind attention. Goodbye. Bye, guys.